Is this? Aha! It is working. Okay. Hi, everybody. So just wanted to do a quick little video to talk about what the doctor and I discussed at my orthopedic surgeon's office today. We are trying to figure out what to do about my chest, and let me check. Okay, so the bones in my chest, my ribs, and then my collarbones have been causing me problems the last couple of years. My clavicle, my collarbone area, everybody from what the ortho says, everybody has a bit of movement in their clavicle area, and so it's not uncommon for a regular person, as he likes to call them, your average Jane, when we're talking about me and me versus everyone else. The average Jane has movement, and so sometimes he made the he said a normal person would go to grab something heavy out of the refrigerator, like a carton of almond milk, and they will pick it up and you can maybe hear a pop or a click or something in this area. That's really common, he said. So that first started happening to me a couple of years ago, and it bothered me because it was noisy, but it didn't really hurt. So at the time, the doctor said not to worry about it. Continuously over, I don't know, about a year's worth of time or so, it started giving me some problems, so started causing me lots of pain, and every time I moved, it felt like something was getting stuck, and so I kept having to try and maneuver myself around and get my collarbone back in place. It never really dislocated, but it definitely was subluxating. So that went on for about a year, and then I guess about a year ago, I started getting a lot of problems with the ribs themselves in the front, below the collarbone. Hurts all the time, causes lots and lots of just pain. So I could be sitting there and it just hurts. But then when I move, anytime that I move, it feels like the bones are breaking almost. Sometimes you can hear them and they'll crunch and stuff, and other times there won't be any noise or anything, but it's just really, really bad pain. Sometimes it feels like I have a ton of bricks sitting on my chest, it's a really heavy feeling. Other times I'll get a really sharp pain. I went to grab my dog the other day and I just reached out for him, and it just was a pain like somebody had taken an ice pick and just stabbed it right into me. So the pain differs depending on what I'm doing. So we're trying to figure out what we can actually do to help it. So first off, he thinks that whereas before with the clavicle that everybody has movement there, he said you're not supposed to have any movement here in this rib area. Everything's supposed to stay still. What he thinks happened is that with all of the movement from my clavicle, that perhaps maybe it built up some scar tissue, and so it was causing aggravation, and it just started to irritate everything below it. And he thinks that I just have a lot of movement and that I'm probably subluxating my ribs in this area. And so it could be causing multiple things. It could be causing what they call costochondritis, which is inflammation around, in the tissues around the bones. And he said that there might be some inflammation, but that a lot of it might not just be inflammation, that there might be like scar tissue in there that's causing issues. And then just the constant movement, and that I'm actually, he thinks from feeling it and looking at it, he thinks that I'm actually just like subluxating, so like partially dislocating. And like if I go to bend forward to grab something, like that, the way that it moves my bones in my chest, it's like they're coming out of where they're supposed to be in there. I can feel them pushing into my lungs at times. Like if I cough, it's extremely painful. If I sneeze, laughing hurts really badly, which sucks because I tend to laugh a lot, and so then it hurts a lot. So the area that he said, like what we're calling it, because I didn't know really what to call it other than my ribs. He said it's the Sterno-Costal area. So what he, sorry, dogs, come here, come here, come here, come here. You want to say hi to everybody? Say hi. Look how cute. Look how cute you are. Why don't you show everybody your cute little face and your beard? Look. Show them your beard. I know. Okay, Raina. No. No. Raina. Okay, Miko. No. Okay. So, this seems to be the occurrence every time I make a video. It gets interrupted by dogs. So, nope, you gotta stay here with me. You're stuck now. So what he's wanting to try and do is maybe look into prolotherapy. Prolotherapy is where they inject something. Doctors use different things, but they inject something into the area of the joint, like around the joint, and it causes inflammation, and it makes your body react by trying to heal it, and then it creates like scar tissue, and it can maybe hold things in place a bit better. So it sounds kind of strange. It's like the reverse of, right now I'm using like Voltaren gel and anti-inflammatories just to try and like keep the inflammation down, and that would be taking it the opposite way, causing more inflammation to try and fix it. I don't know how that's gonna work. I'm gonna post some stuff on the blog below this video about the research that I've come up with on prolotherapy and EDS, because there's a lot of mixed results, a lot of mixed opinions, and I've had some friends that have tried it and it's not been successful for any of them. I don't think that there's one friend that I have that it's been successful for, but I don't know anybody that's had it done in this area, and the doctor didn't know anybody that's even had it done in that area, so it's kind of a strange area to have it done in. Normally, like, they would do it maybe in the back, or like the knees, the elbows, different joints like that. So I'll put all the information that I found below, and some doctors that do prolotherapy, you know, think that it could help EDS, and others think that it's totally pointless. Like, if your collagen is already faulty, then putting something in there that's going to make more faulty collagen is not necessarily going to stabilize anything, and things may just stretch right back out to where they were. Also, I hear it's extremely painful. And the other thing is that insurances don't cover it, so it's very, very expensive. The appointment that I have set up to go see the doctor that will do the prolotherapy, every appointment is $450, I think, $425 or $450, and you have to go back and do multiple sessions. So it's a continual thing, and every 6 to 8 weeks. And so that's $500 every 2 months, or a month and a half, 2 months is a lot of money. I don't have that just to throw around when I don't even have a clue if it's going to work or not. So I don't know yet. I don't know where we're going to go, but at this rate, I've been hurting so bad, and nothing that we're trying is helping, like topically and like with ingesting meds and stuff. We just don't really know what to do because it's such a weird area to treat, but the pain is just getting so bad, and it's affecting me every day, all day long. So we're looking into prolotherapy, and we're also just looking into modification of movements. So like occupational therapy type things. Don't bend over and pick something up because it hurts. Don't do what I just did and pick up my dog the way I did because that's painful. Trying to modify my movements so that I'm obviously doing things that are like causing less stress on that part of my body. So anyway, we'll see how it goes. I'll keep you posted, and I will put all the info on prolotherapy below, and I think that's all for now. I hope you guys have a good night. Bye. Miko, come here. Come here. Really quickly. Just say hi. Say hi to everybody. Say, hi, I'm so cute. I'm a cute teddy bear, Ewok, monkey dog. Yeah? Are you cute? Are you cute? You are. You're so cute. Okay. Say bye-bye, everybody. Bye-bye, EDSers and Potsies. Bye-bye.